Dr. Joanne Yanez, Executive Director for the Association of Accredited Naturopathic Medical Colleges. And today I have with me Dr. Ryan Bradley. Dr. Bradley received his ND degree from Bastyr, his Master in Public Health and Epidemiology from the University of Washington, and currently he has done so much within the naturopathic profession. He is faculty at the Division of Preventive Medicine at UC California, San Diego, and currently serves National University of Natural Medicine as the Director of Research. And so I am very excited to have with us Dr. Bradley, and with that, I'm going to turn it over to you. And I know that you'll be talking a little bit about your background and your history and maybe some of the research initiatives that are going on at NUNM as well. And so with that, I turn over today to Dr. Bradley, and I'm going to make my face go away, but I will be here on the question panel. Thanks so much. Thank you for coming.
Thank you, Dr. Yanez. I appreciate the introduction, and thank you all of those who are out there listening in. I appreciate your time and your attention. Please do ask questions. I will reserve plenty of time at the end of the presentation to address as many of your questions as I possibly can. So today we're going to talk a bit about naturopathic therapies for type 2 diabetes. Along with that conversation, we'll talk some about naturopathic medicine in general, and specifically my background. And my path to naturopathic medicine is quite unique. What you'll learn is that everyone sort of has a unique life story, a unique path by which they found their way to naturopathic medicine. Mine actually started when I was a junior high school student, or a high school student, in that my family frequented a natural health food store in South Central Pennsylvania. I went to high school in South Central Pennsylvania, and there wasn't a whole lot of influence related to natural health or wellness in that region. But my mother, my family, you know, we grew up on a farm. We grew up eating garden-raised vegetables and, you know, drinking fresh water, having access to clean air. And so my family always had sort of a natural health slant to our behaviors. You know, we used lots of home remedies. We rarely went to see physicians, etc. And so this had a little bit of an influence on my background. When I went to undergrad, at the time I was interested in pursuing a degree that was going to pay me well, frankly, that was going to lead to some career security. And so my undergraduate degree is in chemical engineering and biotechnology. And as I was going through my undergraduate training in chemical engineering, I realized pretty quickly that I didn't want to be a chemical engineer. Spending a whole lot of time around chemical plants or pharmaceutical plants wasn't really my cup of tea, and so I decided to start pursuing graduate school. And my background in chemical engineering provided an excellent background to pursue a variety of graduate degrees. Before going to naturopathic medical school, I began a PhD program in pharmacology at Duke University, and I was convinced that I wanted to do to do drug development focused on natural sources of drugs. I was very interested in botanical medicines and using herbs as a source of new medicines. I was particularly interested in an area that at that point in time very few people talked about and really knew anything about. More recently, it's become more popular, and this is the area of nootropics, or drugs or substances that are thought to enhance cognition and enhance learning and memory. And I was very interested in that area as a graduate student, and I did start down a PhD pathway to get advanced training in that area. I had a very hard time finding mentors who were interested in botanical medicines and who were willing to sort of entertain my ideas related to drug discovery from herbal medicine sources. And so it was challenging for me for a variety of reasons. I then remembered, this is going to come back to the health food store in South Central Pennsylvania. As I was deliberating about graduate school and whether or not to continue in my PhD program, I remembered the words of the owner of that health food store in South Central Pennsylvania, and she recommended that I look into a university called Bastyr. And literally, this is a true story. The first time that I learned of Bastyr, and the first time that I read the philosophy of naturopathic medicine, was as a graduate student in a basement pharmacology building on the campus of Duke University, deciding whether or not to stay in my PhD program or whether or not to leave. And at the time, the popular search engine was Yahoo. And so I remember I did a Yahoo search for Bastyr University, and I was able to access a black and white list of the philosophy, the tenets of the philosophy of naturopathic medicine, as well as the curriculum of naturopathic medicine. And for the first time, I felt like I found where I belonged, in that I was looking at a medical curriculum that was inspired by a wellness philosophy and a philosophy oriented around sort of the healing power of nature, as well as using natural therapies and naturally derived medications for the treatment of disease. And I knew in that moment that naturopathic medicine was my calling and was my path. And I spent the next year, I left that PhD program, and I spent the next year applying to Bastyr and preparing. I had one additional prerequisite I think that I had to do to be eligible. And so in 1998, I started my naturopathic medicine training at Bastyr University. I graduated in 2003. And I did a residency. I decided at the time that because I was just coming out of my clinical training, that it was the best time to do a residency, and that doing a residency would be important for my clinical confidence and skills development. So I did a one-year residency at the Bastyr Center for Natural Health in Seattle. I then started pursuing formal research training. And at the time, there was a postdoctoral research training program at Bastyr that was funded by the National Institutes of Health. And I applied for and was given a position in that training program. And so I started my first 3 years of training. While I was in that program, I started my research emphasis on type 2 diabetes. And my early research in type 2 diabetes was evaluating the quality of care that people with diabetes were receiving at Bastyr, as well as assessing their outcomes. I was really asking the question of, well, what happens to these people? They come for their diabetes. Do they get better? Do they get worse? Really, what are their outcomes? So that was when my research in diabetes started, was right after my residency and those first couple years of research training. I then applied for and was accepted to a 5-year research training program that was hosted in the School of Medicine at the University of Washington, also in Seattle. So I started training within the walls of the University of Washington. It's a very different setting, obviously, conventional medical school. They also had a school of public health. And it was a very different world than what I was used to at Bastyr. And I started pursuing a master's degree during that time, and eventually completed a master's of public health degree in epidemiology, the field of epidemiology from the University of Washington. I graduated with that in 2009. And so I stayed in research training programs until about 2012. And so I never really expected that I would do that. As I was graduating and as I was making my career choices, I thought that I would pursue more clinic and more time in clinical care. But research became a real calling for me, and I had some research training opportunities that opened up to me, and so I really immersed myself in research training. And so I ended up spending about 9 years of additional training between my residency and then 8 years of continuous clinical research training between Bastyr and the University of Washington. preparing me to be really an independent clinical researcher in the area of complementary and integrative health. So in 2012, I was working at Bastyr University. I was a clinical faculty member at Bastyr and a research faculty member at Bastyr. I actually transferred with Bastyr to California and was an early faculty member at Bastyr University, California. And in the meantime, I established some research collaborations at the University of California, San Diego, UCSD, which ultimately led to a part-time research faculty position for me at UCSD. And then in about 2014, I was recruited back to the Pacific Northwest by the National University of Natural Medicine as their assistant director of research here at the Healthcott Research Institute at NUNM. And then just this past December, I was promoted to director of research here at NUNM. So there's a bit about my past. And one of the bullets here mentions extracurriculars. I do have time for extracurricular activities, and it's one of the reasons why I really enjoy the Pacific Northwest is, of course, access to natural beauty and relatively pristine wilderness areas. I do also surf and kite surf, and so I have a good excuse to get back to San Diego from time to time to maintain my work at UCSD, and that gives me a few chances to surf a little more often than here in Portland, Oregon. So moving on to type 2 diabetes, I don't have enough time to talk about every therapy for which we have evidence, in type 2 diabetes. However, I'll highlight a few of them that are more timely, I'll say. And categorically, I think there's an approach to type 2 diabetes that naturopathic doctors, naturopathic physicians take very seriously and implement every day in their practices. And one element of this approach is the importance of really individualized nutrition, in that part of treating the whole person really has to do with hearing and evaluating what patients are telling us about the way that food impacts their body, and in the case of diabetes, about the way food impacts their blood sugar. And then one of our jobs is to provide some guidance, provide some education on how to personalize or individualize their nutrition, and in order to sort of maximize the benefit. And this is an area that fortunately science is really paying more and more attention to. And you'll hear about some concepts such as time-restricted feeding. So time-restricted feeding is this idea that we should really limit the hours of the day when we eat, and that current evidence suggests about a 12-hour window. So limiting all food intake into about 12 hours of the day. And multiple clinical trials now have evaluated this approach in type 2 diabetes and other metabolic diseases, and it seems to show some benefit. Another area is intermittent fasting. Fasting has long been an element of the naturopathic tradition, and I think historically many people have been resistant to fasting because we get concerned about safety, patient safety. And in diabetes, you get concerned about things like low blood sugar or hypoglycemia. That's more important in type 1 diabetes, but it can become an issue in type 2 diabetes, depending on how restrictive the diet is and how long the fast continues. And so more recently, there's been this idea of intermittent fasting, of maybe fasting 1 day a week or 2 days a week as a way to induce a metabolic recalibration or a metabolic reset. And once again, the evidence is really sort of catching up with this tradition. And I think this is something to point out when it comes to a lot of therapeutics in naturopathic medicine. You'll hear me talk about it in the context of the microbiome here in a few minutes. In that, in a lot of ways, the science is finally catching up to therapies and practices that have been present in naturopathic medicine for a very, very long time. And fasting and intermittent fasting specifically is another example. There's a lot of interest in the popular press now around the ketogenic diet, specifically the ketogenic diet for weight loss. And we know that weight is highly correlated with one's risk of developing type 2 diabetes, and is highly correlated with progression of type 2 diabetes once it's in place. And so, strategies like ketogenic diets for weight loss, ketogenic diets for type 2 diabetes, these are still considered emerging therapies. These are still experimental, and yet many people are doing them. And I would suggest that many people are doing these therapies really without guidance, and they don't know who to talk with about their process. They don't necessarily have access to a dietitian or a nutritionist, and then depending upon the background of that dietitian or nutritionist, they may or may not be familiar with these diets, and they may or may not be willing to move beyond a standard of dietetics care in order to guide a client or a patient through a dietary strategy that's intensive, like a ketogenic diet. I would suggest that a naturopathic doctor is the perfect ally to safely navigate through a sophisticated diet and an intensive diet like the ketogenic diet, and that can be a real important member to the team. Another category of therapies that are regularly included in naturopathic care of type 2 diabetes are therapies that we refer to as mind and body therapies, or mind-body practices. These include things like yoga, mindfulness-based stress reduction, different forms of meditation, other movement therapies such as qigong, tai chi. The evidence base for these therapies is becoming quite overwhelming, and we could look at this in a very narrow focus and look for, say, clinical trials on yoga for type 2 diabetes specifically, and you would find some. There have been some trials that have tested yoga for type 2 diabetes, looking at say blood sugar lowering for diabetes, and some of those trials have been positive, some of those trials haven't been positive. But if we look at type 2 diabetes as really a person with diabetes, and a person who often has sleep disturbances, often has chronic pain, often has a higher burden of stress, both because of their diabetes and also just because of general lifestyle. When we look at the many sort of facets of that person who happens to have diabetes but also has these other things going on, then suddenly the evidence mosaic, as I like to refer to it, really opens up when we talk about things like yoga and meditation. For example, if we look for trials for yoga and chronic pain, the evidence base is very strong. If we look for trials for, say, mindfulness-based stress reduction in chronic pain, or for reducing stress, for adhering to dietary practices more regularly, again, suddenly the evidence base opens and we see lots of support for these mind and body therapies, not limited to just lowering blood sugar, but also for supporting the person who has diabetes and helping that person potentially address lots of associated symptoms that can accompany diabetes. The third category of treatments or therapies that I'll talk about very briefly is natural products and herbal medicine. And let's face it, it's really only naturopathic doctors who are trained experts in the use of these products in the routine delivery of clinical care, and certainly the use of these products in primary care. There is no other medical discipline or specialty who gets training from the very beginning of their studies through their clinical training on how to use these products appropriately in practice. And people, I'm sure somebody will have a question or somebody will have a thought, well, what about integrative medicine? Well, the reality is that most integrative medicine programs they're postdoctoral programs. There are some fellowships, there are some continuing education conferences and things where you can pick and choose and sort of dabble in some of these areas and some of these therapies, learn individual dietary supplements, for example, and the evidence that might support them. But when it comes to having an immersive experience that includes the background in pathophysiology, the appropriate context of nutrition and clinical nutrition in the degree of in the context of sort of clinical and medical risk, all the way through the clinical training of actually seeing how to use these therapies effectively, there is no medical specialty that does that to the same degree or to the same the degree of competency that is done in naturopathic practice. So I think we really are the leaders in this area. We're at the edge of the curve in terms of defining what primary is and what it should be. And type 2 diabetes is just one example of this innovation in practice. So very quickly, I'll highlight some other areas, some emerging areas in type 2 diabetes. There's a lot of interest by the public about the microbiome and the microbiota. And what science is telling us is that we're not just the collection of our genes, of human genes, but we are also walking around with a collection of genes from the many, many billions of other organisms that reside in our body, that reside in our gut, that reside on our skin. That we're only just beginning to learn about how these different organisms impact our health. And here on my next slide, I ask, what are you feeding your microbiota? And I'm saying this, somewhat as a joke, but also somewhat seriously, and that the conversation is starting to shift away from what is the right diet for you, what is the right diet for the host, and is starting to lean more towards what is the right diet for your microbiota. What do you need to feed your microbiota such that they are expressing the genes that we want them to express, and maybe not expressing the genes as much that we would rather they not express. And we have learned that there are significant dietary contributors to the composition and diversity of your microbiota. And one of the strongest predictors of the diversity of your microbiota is the diversity of plant foods that you have in the diet. And it isn't even so much the volume of plant foods, but it has to do with the variety of plant foods that are present. So I would wager that there are very few medical professionals who are trained to be able to have this conversation with a patient, to actually look at a patient with type 2 diabetes who's bringing questions related to their microbiome and saying, hey, what's happening with my microbiome now? What should it look like? And how do I need to change my diet, or what supplements do I need to take to support a healthier microbiota and a more favorable microbiome? I don't think that there is another provider type out there in the licensed health professionals that is qualified to be able to have this conversation other than a naturopathic doctor. I think we are the only ones, and admittedly, it's an emerging area of science. But in terms of having enough background understanding and enough understanding of the state of the science in this area to have a pragmatic conversation about how to implement it in someone's health plan, I'm pretty certain that naturopathic doctors are the only ones that are really ready for that conversation. This is important in bringing it back to diabetes and specifically to blood sugar. We're learning just how important the gut microbiome is to one's individualized response to food and to a dietary pattern. And I won't spend a lot of time on this slide other than to say that very recently the concept of individualized nutrition and the influence of the gut microbiome on nutrition has been demonstrated through very, very elegant science. And this was a publication that was in the journal Cell. It's about 3 years old now. But in this study, what they did is they tracked a cohort of people, a sample of people, about 800 participants. They measured all sorts of things related to their food, their sleep, their physical activity. They connected them to a continuous glucose monitoring device that was literally measuring their glucose more or less in real time. And then they fed them various standardized meals that had known sort of macronutritional composition. And the purpose of this study was to try to learn what of these factors influence the rise in blood sugar after these standardized meals. Some of you may be familiar with the concept of a glycemic index, which looks at a standardized amount of a food and then measures blood glucose for a certain amount of time after that food is consumed. And one of the criticisms of the glycemic index is that it's actually quite variable. Even though there are trends for a food is likely to have a higher glycemic index than some other foods. If you feed that food to 100 different people, there's going to be some variation in how that 100 people respond to that food in terms of their blood sugar. And this has always been a criticism of the glycemic index. Well, what this research in Cell does is it tries to explain that variability. And several factors came out as being strong predictors of the variability in blood sugar. Obviously, the content of the last meal was important, but other things that were not anticipated, such as time since sleep, time since physical activity, the carbohydrate content specifically of the meal, but then also the microbiome, the microbiota composition of that individual. Now, for most naturopathic doctors, this all sounds very obvious, and we're all kind of like, well, duh, of course these things matter. However, we need the science to show it. We need the science to demonstrate that this really is a valid conceptual model of blood sugar, and it has been validated. This study in Cell clearly shows that that blood sugar response is highly individualized, and that there are more factors from one's lifestyle, such as sleep duration, sleep quality, physical activity, nutritional content, and then again, also composition of the microbiome that will have an impact. I think what all of this does is it really points to I consider the most important tenet of naturopathic philosophy, which is the tenet of doctor as teacher, and that is taking the time to educate patients on these factors. And it's really only through that education that we might have a chance at empowering individuals to make behavior changes that are important to, say, alter their diet, improve their sleep hygiene, get a little more activity, etc. And in the context of type 2 diabetes, those factors are critical. So we know that advice related to diet and health promotion is routinely delivered by naturopathic doctors in practice. We've measured this in multiple studies now that have evaluated the delivery of health promotion counseling by naturopathic doctors. And we've done some comparison to the values that are out there for some conventional models of care as well. So for example, in our studies looking at delivery of diet advice, we saw between 98 to 100% of patients with diabetes received advice on their diet. This is in contrast to other statistics that show as low as 28% of patients with diabetes received advice on their diet. With exercise, again, we see high rates of delivery in naturopathic practice compared to much lower in other settings. And then stress management is also quite unique. This value here for 0 is because we actually didn't assess that in the particular study, but we see somewhere around 50 to 70% of patients with diabetes also receive some advice on their stress management. Now, these statistics are important for lots of reasons. One, stress management, we know that having high stress and having depression in particular is a real strong barrier to self-care and behavior change in type 2 diabetes. If someone has a high burden of stress, and especially if they have depression, they're much, much less likely to make healthier behavioral choices. But the other reason that these statistics are important is because we actually have a guideline that's released by an organization called the U.S. Preventive Services Task Force. This is a U.S. national body that releases guidelines for primary care providers related to the delivery of prevention and prevention-oriented advice in clinical care. And the U.S. Preventive Services Task Force has a guideline that all adults who are at risk who have diabetes or who are at risk for diabetes or cardiovascular disease should receive this advice in primary care. They should be given health promotion counseling related to diet, physical activity, and stress management. And I would submit that naturopathic doctors are a way for the healthcare community, and certainly for primary care, to improve their statistics in this area, because the national statistics for general primary care and delivering health promotion counseling are actually quite poor. And yet in naturopathic medicine, we see it happen every day, practically with every patient. So I think that this is a value added for naturopathic medicine, even to primary care as we know it more conventionally. We also see this manifest in terms of changes in patients with diabetes. And specifically, we did a study with an organization in the Seattle, Puget Sound area, used to be called Group Health Cooperative. It's now Kaiser Permanente Washington. They've changed hands. But several years ago, we did a study asking the question, what happens to patients with diabetes after receiving naturopathic medical care for 6 months or for a year? What happens to their glucose? What happens to their mood? What happens to their activity, their self-care, their self-efficacy to make change, as well as their stress, etc.? And here are the results shown here on the figure. These are the results from 6 months, and then over on the right-hand side are the results from 12 months. And what we noticed is that in nearly every domain that we queried, we saw improvements in those individuals who had received naturopathic medicine for that time, in addition to their primary care. And I will say that Group Health Cooperative has probably the highest quality primary care for diabetes in the country. Their quality scores are excellent. Their care delivery system is excellent. They have lots of resources for their patients with diabetes. And yet still, when naturopathic medicine was added to that, we saw additional improvements. So for example, we saw almost a 45% increase in their self-monitoring of their blood sugar. This is a very important monitoring practice for people with diabetes. We saw a 34% improvement in mood. We saw about a 28% increase in physical activity. We saw a reduction in, stress. This is a reduction in perceived stress. I'll back up. We saw an increase in self-efficacy. So self-efficacy is like empowerment. It is how likely people are to actually make changes in their lifestyle. So we saw an increase of self-efficacy by about 26% after that 6-month period. And the list goes on and on in terms of improvements. Notably, several improvements persisted to 1 year, including the glucose checking, the mood, the self-efficacy, as well as a commitment to change lifestyle. Notably, all of the naturopathic medicine had been delivered within the first 6 months of care. So the changes that we see that remained at 12 months, this all would have been potentially residual effects of naturopathic medicine, even after the care had already been delivered. So it suggests a potent response. When we look at blood sugar, specifically what happened to blood sugar for these individuals, we look at a measure called the hemoglobin A1C, which is a measure of average blood sugar concentration. And you can see here that for those individuals who were in the naturopathic care group, their hemoglobin A1C decreased by almost a full percentage point in that group. And so that's equivalent to some medications, and it's considered clinically meaningful to have a reduction of that magnitude. So not only do we see all the intermediate measures of self-care, self-efficacy, mood, et cetera, improve, but more of a hard clinical biomarker of glucose also improved during the naturopathic care period. So I've alluded to some of these, but also just pointing to the future. What are some things to look out for? I think we'll see more and more emphasis on mindfulness and mindfulness-based stress reduction, mindful eating, and as well as yoga and individualized yoga. I think we'll see more research on yoga beyond asana, beyond postures, but also more on other aspects of yogic lifestyle, including things like pranayama, maybe yoga nidra, or more meditation practices for sleep. So I expect we'll see more and more research in this area. We're only at the beginning of our understanding of personalized diets and the influences that impact our response to different foods. I think that especially in the context of diabetes, this will be an area of ripe innovation. And one thing that I think naturopathic medicine offers, and another thing I think it offers, is naturopathic medicine is a model of rapid translation of evidence into practice. And some people point at that and criticize it of maybe the evidence isn't quite robust enough to bring into practice. But at the same time, we face a problem in our healthcare delivery system, is that so many therapies get sort of stuck in research and they never make their way to practice. So I actually think that naturopathic medical practice is a fascinating laboratory to study the rapid translation of evidence into practice. And rather than criticize it, we should embrace it as a flexible model that we can learn from. So I think personalized diets will be another area that we see excel. Microbiome transplantation is an area. I think we're going to see lots of technology in the microbiota and microbiome space, including natural products as well as pharmaceuticals. And I think the research in type 2 diabetes will be really insightful in terms of the way that our glucose and heart disease risk is influenced by our microbiota. We're seeing more and more precise natural product delivery systems. I'm thinking of vaping. There's a real lot of interest now in looking at vaporized delivery of herbal medicines as a way to increase the bioavailability. So that's very cutting edge, and we're really only at the beginning of the science in this area. And then I think more and more we'll see natural products derived from cannabis. There's good reasons to implicate the cannabinoid system and the endocannabinoid system and glucose regulation and metabolic control. I don't think we know yet how best to manipulate that, either from herbal medicines or from tailored synthetic medicines, but it's something to keep an eye out on. So really quickly, and I know I need to allow some time for questions. I'm eager to hear some questions. Why naturopathic medicine, and why now? And I will acknowledge that even for me, it was a risk. I felt like I was taking a risk going in an unconventional direction for my medical training. And all I can say is that there is no better time than now for naturopathic medicine. We have a broken healthcare delivery system. I think that many would agree with that. Our costs have skyrocketed and the quality of our outcomes in the United States have not improved. Speaking specifically about type 2 diabetes, we have more cases of type 2 diabetes than ever. The estimates are that about 35% of the adult population are at risk and have active prediabetes, and about 10% of the adult population have type 2 diabetes now. We also know that fewer than 10% of people that have diabetes have all of their risk factors, their glucose, their lipids, and their blood pressure under control. So we have 10% of our adult population with this disease. We have 35% more of our adult population at risk for the disease, and only 10% of people actually have their risk factors controlled. So that tells me that the way that we're approaching diabetes in conventional healthcare doesn't work. And that if we looked at a model of care delivery for which the effectiveness was only 10%, would anybody look at that and say, oh, well, that's strongly effective? Clearly, our therapies work really, really well for that chronic disease. I don't think anyone would say that. So type 2 diabetes has a lot of potential for innovation. It has lots of reasons that it needs to be improved. I think naturopathic medicine is a strong contributor to that. And I think that we have a lot to offer conventional biomedicine in terms of ways that we might make it better. I say here that we've never had a stronger wellness-oriented culture. We see wellness and wellness-oriented messages on everything from magazines to billboards to airline ads. And so there's never been a better time culturally for the therapies and the orientation that naturopathic medicine offers to meet the people that need it. And I say here somewhat in jest, some of you may have heard this term biohacking, and I say, naturopathic doctors have been biohacking the human body for over 100 years. And it's true, biohacking is not new to us. We have been trying to optimize our sleeping, eating, exercise environment, as well as our personalized nutrition ever since the beginning of naturopathic medicine. So this concept of biohacking the human body, this isn't new. This is what we're trying to do for every person with every condition, really every day. Another reason why I think the timing is right is because we are in an influencer-based economy. We are in a time and a place where startups and where smaller businesses and individuals can have a greater influence than ever before. And I say here, naturopathy pushes the curve on primary care. We do exemplify a more comprehensive model of primary care that provides patients and the public with elements of their primary care that just are not available in conventional biomedical primary care, or may be available in a very, very limited way. So the other thing that I think naturopathic medicine offers is tremendous flexibility in practice and career direction. That is in clinical practice. There's also academia, and of course I represent a naturopathic doctor who has focused their career primarily in research and clinical research. But all of the career streams that are available to medical providers from any other discipline are available to you in naturopathic medicine. Certainly the flexibility to start a private practice or open a joint practice. There are more and more opportunities in academia, including conventional institutions. I do have a faculty position at a conventional institution at the University of California, San Diego. As a naturopathic doctor, I do not have a PhD. I do not have an MD. I'm a naturopathic doctor, and I have been able to secure that position through my research and through my contributions to that university. And so really the timing has never been better. I think that There's also a misconception around job security in other medical disciplines, in that many people say, oh, well, if I go to conventional medical school, I'm guaranteed to have a job. And I would say that, there's some credibility to that, in that, if you go to medical school and you graduate and get boarded and licensed as a medical doctor, you are likely to find a job. There are jobs, there are places that would hire you in a variety of different capacities. My question for many of you, and for many people considering naturopathic medicine, is really, is that the job that you would want? And I ask this because I think few of us have had a lot of exposure to conventional primary care settings, and few of us have had very detailed interviews and conversations, say, with conventionally trained primary care providers in terms of their day-to-day and how much they like their job, and whether or not they're satisfied with their direction. And I think when we look at national statistics related to provider burnout, for example, we can see that maybe those positions, they're not as glossy as they might appear from the outside, in that whether it be the context, whether it be the limitations put on standards of care, whether it be on community expectations or influences from pharma and insurance companies, there's actually not a lot of flexibility in what we can do in sort of more conventional primary care. Things are actually scripted pretty tightly for many providers, and in many cases they're not very happy with their jobs. And we also hear this in integrative medicine. We hear this by many people who pursue integrative medicine fellowships, is that they're trying to get back to their real medicine. They're trying to get back to why they wanted to practice medicine. Well, I would suggest that starting with naturopathic medicine may have been another avenue to really practice what we believe in and what we know is critical to human health and wellness. So there's never been a better time. Naturopathic medicine offers a lot of flexibility in practice and career direction. So I would think about that decision pretty carefully. This is an acknowledgement of the 6 principles of naturopathic medicine. I think that in some ways, many other providers would say they resonate with elements of this philosophy, but I think when it actually comes to looking at what happens in practice, I can say with confidence that I think every naturopathic doctor that I know exemplifies these principles, and these are their guiding principles in practice every day in their interactions with each person. So it's not just lip service, it's true fidelity to these principles of practice. Looking forward, I was asked to talk a little bit about my future plans, and then really briefly any advice that I would have. And I'll keep this really brief. I would say my future plans are to keep doing what I've been doing, but to grow the Research Institute at NUNM is a major goal of mine. I am in the position of being the director of the Research Institute, and so to have a naturopathic doctor at the helm of the Research Institute is new for all of our naturopathic medical colleges. The research that we're hosting here, we just received an R01, a large research grant from our National Institutes of Health. So we're actively implementing that NIH-funded R01 grant at present. We also are putting the infrastructure in place to collect outcomes from our clinics. And this is actually an international consortium of naturopathic clinics that spans from Australia to Canada. And together, we're finally going to systematically collect some data on what happens to people as they pursue care at our naturopathic medical school clinics, and a variety of other projects that we have going here, including some that I don't really have time to get into, unfortunately. So I'll focus on advice. And I'll say my advice for prospective students, what I wish I knew then that I know now. I think the biggest thing is that if you feel naturally drawn to naturopathic medicine, then it is probably the right path for you. You are the right person for it. And I think that I wish that I had that confidence when I was a student. I spent several years feeling very apprehensive about whether or not I had made the right choice. And now I know without a doubt that I made the right choice, that this is the right profession for me to invest in. This profession has served me very, very well. It has created a community around me and around my work that I wouldn't sacrifice for anything. And I guess what I wish I knew then is just that it would all work out, you know, that there really is a way to have a viable, successful, lucrative, generative professional career in naturopathic medicine, and that can be done in a wide variety of areas, including clinical practice. And for me, that it's also possible for research. It is possible to publish peer-reviewed research papers in high-impact conventional journals as a naturopathic doctor, and it is possible to receive rather large NIH-funded clinical research grants as a naturopathic doctor. And there really are no limits to what can be done as a naturopathic doctor. The only limits are the limits that a person places on themselves about what they can and can't do. So here's an email for me. Feel free to reach out. You can email me anytime, and I'll stop there for a few questions.
Awesome. Thank you, Dr. Bradley. Would you mind going to the next slide just that has the events going on right now? Fabulous. So if you found today interesting, I hope that you can join us next week for our naturopathic virtual fair, where representatives from all 7 accredited schools will be present. You can ask questions, or if you don't have any questions, you can go ahead and just look at the questions other people are asking. So with that, I'm going to talk about or give you some of the questions that have been asked. So Dr. Bradley, you spent a fair amount of time talking about the microbiome, the microbiota, and there was a question about kombucha, possibly as a substitute for probiotics. Can you speak to maybe some of the, fermented foods and the role of fermented foods in the microbiota?
Sure. Well, I'll share what I know, and this is another area where I think the public is really guiding the research in a way, and that I think there's been a lot of interest in fermented foods by the public. Obviously, the rise of commercially available kombucha, like, that's amazing, right? Like, I was shocked to learn that it's like a $10 billion industry, just kombucha alone. And so that shows you that the public are very interested in these foods and very interested in fermentation in general. I wish we knew exactly the role of fermented foods in maintaining, quote, a healthy microbiota, and whether or not those fermented foods would substitute for probiotics. I think in some cases we know quite a bit. For example, there have been studies that have compared encapsulated probiotics as a dietary supplement compared to yogurt, right? And so yogurt, when we think about the studies that have been done looking at nutritional patterns and things, the only fermented food that's going to show up frequently enough to really draw any conclusions over is going to be yogurt. These other foods, natural pickles and kombucha and things like that, have been too recent to show up in a lot of these studies. So yogurt does look as though it improves the gut flora. Yogurt as a source of probiotics has been studied in multiple systematic reviews and has favorable influences on insulin sensitivity, on body weight, on blood sugar regulation. And so it does appear as that yogurt is a evidence-informed source of probiotics to improve metabolic health. I have not seen any studies on kombucha. I haven't seen any studies on kefir or sort of other forms of fermented foods. I will say really briefly that one study that I didn't talk about earlier that we're starting here at NUNM is a longitudinal cohort study of our students. And this study is called the International Cohort on Lifestyle Determinants of Health. And we're focusing on students because we think that the students of naturopathic medical programs and complementary medicine programs generally are very, very unique in terms of their dietary practices, their self-care practices, their stress management practices, etc. And we're hoping to learn answers to some of these questions, such as, how does a robust intake of naturally fermented foods impact health and impact the diversity of the microbiota? We are going to be doing 16S RNA sequencing of the microbiota as part of that cohort study. So hopefully in a few years, we'll have some more information as to your question. In the meantime, again, my answer is going to be limited to what we know about yogurt, which appears to be beneficial.
Awesome. Thank you so much. There are a few questions. I'm going to combine them a little bit, which are really about research and how naturopathic research is conducted. Does it follow the same standards as conventional research in other institutions? And B, is there research? So you spoke about effective naturopathic therapies in diabetes, but does this exist for other illness conditions? So if you can just speak to a little bit of the veracity of naturopathic research, as well as some other conditions and just kind of the scope of research in naturopathic medicine.
Yeah, sure, absolutely. So I'll try to address two separate questions. One has to do with research methods used in naturopathic medicine research, naturopathic medical research. The other has to do with, what other studies have been done looking at clinical outcomes from naturopathic practice. I'll respond to the first one first. We use a wide variety of research methods, but we don't make any of them up ourselves. We are applying classical research methods, whether they be randomized controlled trials or classical epidemiology using observational methods in existing cohort studies. We do, similar bench science in some areas. We do similar, clinical sort of mechanistic studies. We're not making up new rules. We're just applying the tools of research to questions that are more germane to naturopathic medicine. I will say that some of our research has a tendency to be more pragmatic than some research that we see out of conventional medicine, but we also see an increasing emphasis on pragmatic research in conventional medicine. So by pragmatic, I mean actually implemented within clinical care. We think fundamentally, I tend to think fundamentally that naturopathic medicine should inform naturopathic practice. So the more research that we can do in the context of care, the better. That said, the NIH grant that we received is for a very classic placebo-controlled, randomized double-masked clinical trial. So I tend to not join the camp of that says, oh, we need brand new research methods to study naturopathic medicine. I don't think that's true. I think we need to ask more creative questions and we need to apply the same methods more creatively, but research methods are research methods are research methods. Regarding, what do we know about outcomes from naturopathic practice, and has it just been type 2 diabetes? No, we've evaluated naturopathic models of care in conditions like primary prevention for cardiovascular disease, low back pain, anxiety, temporomandibular joint dysfunction, low back pain. There's been a variety of chronic diseases for which naturopathic practice has been evaluated. And so far, knock on wood, but so far, all those studies have demonstrated some benefit, either directly improving medical risk, and or supporting people through behavior change, through mood changes, through activation and empowerment. So we have not evaluated naturopathic or outcomes from naturopathic practice in all primary care conditions or all chronic diseases. It's one of the motivations for the research that we're doing within the naturopathic clinics, is to do more assessment, especially in the top primary care conditions. But there has been quite a number of studies that have been done on naturopathic medicine. I think one of the research questions that comes up is naturopathic medicine one thing, or is naturopathic medicine the collection of lots of different tools under the umbrella of naturopathic practice? If we look at the evidence for naturopathic practice as for all of the individual tools, dietary approaches, natural supplements, mind and body practices, manual medicine, stress reduction, etc., the evidence base is enormous for all of the tools that are in our toolbox. If we look at naturopathic medicine as one thing, that, we need to evaluate the practice of naturopathic medicine in all of these conditions individually, the evidence base is weaker. It's still quite strong, and it's strong in some very important conditions like diabetes and heart disease, but it is weaker than it is for all the individual therapies.
Thank you so much. Somebody here was asking about references for naturopathic medicine and diabetes. Do you have any books or resources that you would point folks toward?
Yeah, well, there are a few, depending on whether you're talking about sort of scientific references or whether you're talking about just information in general related to naturopathic medicine and diabetes. Scientific references we tend to use, the National Library of Medicine, or PubMed. And so, PubMed, you could do a quick search for it and find it, but this is the library that's maintained by the National Institutes of Health, and all indexed peer-reviewed literature shows up is indexed, we say, on PubMed. So when I started in naturopathic medicine and doing naturopathic medicine research, when I typed naturopathic medicine into PubMed, there were maybe 3 articles that came up at that time. Now, if you type in naturopathic medicine into PubMed, you'll get hundreds of citations in terms of individual studies that have been done related to naturopathic medicine. So there is a lot out there. In terms of books and other resources related to clinical interventions and advice for diabetes, I would direct you to the book by Mona Morstein. Mona is a naturopathic doctor. I believe she's still in Arizona, and she's written quite an excellent book around naturopathic management of diabetes. So I would recommend her book. Unfortunately, I don't know its title.
Thank you so much. There were a couple questions here about some other specifics that you may or you may not know about, so we'll do our best here. There was a question about the Wim Hof method in diabetes, which incorporates breath work as well as contrasting hydrotherapy. Is that something you're familiar with, or would you mind just speaking about breath work and hydro?
Yeah, sure. So I'm not familiar with the method under that label. So I don't know of that label. It sounds specialized. Maybe somebody made it up. I don't know. But I will certainly speak about breath work. We do research here related to breath work, looking at heart rate variability and how to optimize breath work to increase heart rate variability to enter a parasympathetic state or a more relaxed state. We focus on a few types of pranayama breathing, but we also focus on what we refer to as paced deep breathing. So this is deep diaphragmatic breathing, but at a regulated pace. So what our work shows is that you can certainly increase heart rate variability and induce a more parasympathetic relaxed state through breath work. We did a randomized controlled trial of one particular type of pranayama for hypertension. Hypertension is a common comorbidity in diabetes, and we demonstrated a clinically and statistically significant reduction in systolic and diastolic blood pressure after 30 days of pranayama breathing in that trial. I personally have not studied hydrotherapy in diabetes. We published a trial earlier this year for hydrotherapy in HIV, but I don't have any experience with research of hydrotherapy in diabetes. We do know, of course, that hydrotherapy, depending upon the temperatures and the duration, is a metabolically demanding activity. For example, contrast, the application of cold requires the induction of metabolic activity to raise body temperature and to do thermogenesis. It probably activates brown fat to do that, but we don't know that for sure. So in terms of incorporating hydrotherapy into a self-care management strategy in diabetes, I think there's lots of reasons to do it. But again, I'm limited in that I have not seen a formal study to sort of quantify the effects. And then in terms of optimization of hydrotherapy for diabetes, I think it's a great research question. I would love to pursue it, but I'm not familiar with any evidence that we have on it right now.
Thank you so much. There was a question about the cost of school, and I'm answering that privately. If you have additional questions about financing your education, please come. We're going to be having a chat on Friday hosted by one of Bastyr University's financial aid officers during Health Professions Week. So come to our events page, and we can point you in that direction for more information on financing your degree. But while we've got Dr. Bradley on, we've got about 1 more minute here. And so I'm wondering if there's a question here about coconut oil, coconut products. There's a lot of controversy regarding different types of oils and what you use and what you don't use. And can you just succinctly, if you can, speak to some of the different oils and the roles in diet.
Yeah, I'll try. This is, I mean, I could spend a whole hour talking about this, which obviously I won't do now. I guess the only thing I would remind the audience of is there is coconut, the food, right? There is, you know, coconut milk or coconut cream, and then there's obviously coconut oil. So coconut, the food, is, yes, it has some saturated fat in it. That's fine. It's also rather high in fiber. That's really good for the microbiome. It's also rather high in protein. So you have this complex whole food in this, delivery vehicle as coconut. That's actually quite well-rounded from a macronutritional perspective. You look at coconut cream, not so much. Very high fat, most of the protein's gone, all of the fiber is gone. It's a different food. You get to refined coconut oil, it is nearly completely saturated fat, short chain saturated fat. And we actually know from the 2 clinical trials that have been done comparing coconut oil to other oils that it actually has a negative impact on low density lipoproteins, or LDL. LDL is a major risk factor for heart disease, and coconut oil seems to increase LDL. In fact, when we want to induce heart disease in laboratory animals, we feed them the short chain fatty acids from coconut oil. So I actually tend to agree with some of the caution that's out there related to the overconsumption of refined coconut oil. I think if you want to eat coconut, eat the whole food, but don't overdo it on the coconut oil itself because it looks like it might be risky. And then in terms of other fats and oils, I think, again, it's a complicated question. I think it depends on whether you're consuming them raw, in which having a highly unsaturated fatty acid is great, versus if you're going to cook them. And I think if you're going to cook an oil, having a highly unsaturated fatty fat as an oil that's going to be cooked is probably negative. It's probably deleterious, because we know that those fats oxidize in the cooking process, and we might actually be doing more harm than good by cooking some of those unsaturated fats. So it all depends on how you're using them and how they're incorporated into the diet.
Thank you so very much. And with that, we are at time for today. I will stay on if there are additional questions for a few minutes. And I thank you all. I thank you, Dr. Bradley, for your time in this really fabulous webinar. And for those of you who tuned in and stayed on, thank you for coming. And we hope to see you again at a future AANMC webinar. Thanks again.
Thank you so much. Thanks for the opportunity. Take care.
Of course.